don't mind if it's 10.
So while you all join, we'll get started really shortly, just waiting for a few more people to come into the webinar room. Lovely to have you with us today. So I think we're going to get started actually, because people are slowly coming in their dribs and drabs, but we only have an hour and I want to use the best time, the most time possible, as we have Emily and Rosie with us. So we might stop sharing this lovely presentation and we will now go to our acknowledgement. I'd like to acknowledge I'm on Wurundjeri land of the Great Kulin Nation. I'd like to acknowledge elders past and present, Aboriginal people with us today in this webinar room, and that land was never ceded. Today's webinar is part of a TriPeaks initiative, which is a collaboration between the Centre for Excellence in Child and Family Welfare, the Victorian Healthcare Association, and the Victorian Alcohol and Drug Association, or VAADA, to support integrated practice and good governance across 3 sectors. And we are indeed learning a lot from each other in this wonderful project that we call TriPeaks. I like to acknowledge my fellow CEOs, Scott Drummond, the acting CEO from VAADA, and Lee Clark from VHA. A little context for today's session. In Victoria, there are not that many young people living in residential care, but enough for us to always be concerned and care about them. There are 9,146 children and young people in out-of-home care, of which 445 at any one time are in residential care. And I'd have to say, most notably, we have the lowest number of children in residential care in the country. Just recently, the state government announced a very significant injection of funding to ensure that all residential care in Victoria is therapeutic. Great gain for those kids, but also for advocates and the sector. Residential care provides homes for children and young people aged 12 to 17 who are temporarily unable to live with family or kin or foster care. It's important that you understand this today because Rosie is going to talk about an initiative that directly works with children in residential care. Today, you'll hear from Emily Cormack, who is the grant manager and with Equity Trustees, who will talk about the Children, Young People and Families Philanthropic Funders Network, which is hosted by the Centre. Emily works with a team of philanthropic professionals managing over 650 charitable trusts and distributing approximately $80 million per year for the not-for-profit purposes of our sector. She manages charitable trusts, including the RM Ansett Trust, which have a focus on supporting and empowering children. Emily has responsibility for the Children and Young People Granting Focus area across 3 funding streams in out-of-home care, disability and education. She's a very busy person, and a lot of you out there will know her, and we're lucky to be able to work with her. She joined the philanthropic sector in 2018, following nearly 15 years working in the community sector and in international development. Emily worked for a number of Australian agencies across a variety of roles, including program management, volunteer management, and fundraising and community engagement. I'm actually now, I think, going to throw to Emily, who's going to introduce Rosie. I don't want to steal Emily's thunder.
Thanks, Deb. Thank you so much for having me. It's fantastic to be here. In fact, one of the great, well, I don't want to say a great thing from COVID, but I think these webinars started as a result of COVID, and I've very much enjoyed being able to learn over the last few years in this way. I'm just going to share my screen and hope that the technology works. And I think we are there. Great. Yes. Okay. But before I begin, I would too like to acknowledge country. So I'm dialing in from Wurundjeri land, and I want to acknowledge the traditional custodians and pay my respect to elders past and present, and to acknowledge any First Australians joining us on the call today. And I'm particularly conscious of the number of Aboriginal and Torres Strait Islander children in out-of-home care that many of you are working with daily, and know that the children are our future leaders, so that the work that we're doing now will positively affect them in the future. Thank you so much, Deb, for the introduction and overview, and it's delightful to be here with Rosie from Youthlaw. Deb gave a little bit of a snapshot, but I just thought I'd give a little summary of who I am and the work that I do at Equity Trustees. So I sit within the charitable trusts and philanthropy team, and it's actually increased since then, Deb. We now manage over 1,000 charitable trusts across Australia, and that's because of a recent acquisition that we've had with Australian Executor Trustees that we're still getting used to that number. For those of you who might not be aware of a charitable trust, an example is the RM Ansett Trust. So Ansett Airlines, Sir Reg, when he died in 1981, he left a sizable estate with the wish that this would support children to take their place in life. And so we grow the income, and then every year we distribute that income to honour his wishes. Our philanthropy has a deep wish to trust-based philanthropy with the aim of creating meaningful impact. And I've got a slide here that just kind of breaks down the way that we try to work at Equity Trustees, because we're focusing on collaboration today. And you can see there the 6 points. So we want to learn from others around us. We absolutely want to amplify the voices of people with lived experience. We want to foster meaningful collaboration. We want to support sustainability for the sector. We want to respond with transparency and empathy at all stages, and we want to share our learnings with others. So it's thrilling to be here today. Within the children and young people area, Equity Trustees, I have a focus on education, out-of-home care and disability. Don't get lost in the words. This is just our vision and mission, and you'll receive a copy of this afterwards. But if you look down right to the bottom of the slide, second last point, where it says that we're working towards reducing the numbers of children in out-of-home care. And that's one of the reasons that we partner with the centre. So now I want to take you back a few years before my time, back in 2017. And there were a number of different funders from Equity Trustees and the Sydney Myer Fund, and they approached Deb Tsorbaris. And I often like to describe Deb as the chief advocate for children in Victoria. And one of the reasons that they approached Deb was that they needed to shift outcomes for children in out-of-home care, and especially at that time for those leaving care at 18. And they wanted to gain a deeper understanding of what others were funding in the space to make sure that we weren't kind of too much funding wasn't going into the right area, or not the right area, and that we were missing valuable, innovative ideas that were happening in space. And they also wanted to understand what was working well in the sector and what services were doing. And from this, we were able to fund a position at the centre and establish the network. Back then, it was called the Out-of-Home Care Funders Network. And 5 years later, we've had a shift to the Children, Young People and Families Network. And the embedding of this network in the centre, I think, has been key to its success. I'm conscious of how far away funders can be from organisations and the direct work that we're going to hear from Rosie later on today. And so it was really important for us to be able to partner with the centre to have that opportunity to be deeply connected, to be challenged about things that we were funding, and to learn. This next slide talks about the journey of the last 5 years. And this comes from the case study that we were able to do with EY a number of years ago, and you'll receive that as part of your notes after the webinar. But so you can see that back in 2017, we worked with the centre, and it was really important for this group to understand why we were coming together and to build our knowledge. And one of the first things that we were able to fund together, which actually wasn't one of our innovation grants, was the Homestretch campaign. And that was from the learnings that we'd had from the centre and from Anglicare at the time about this campaign to increase the age of kids leaving care from 18 to 21. We've been able to grow the membership across the sector with a number of different funders, large and small, like all kind of spectrums coming in, and with very different kind of focuses as well, and then develop this collaborative funding model. And from this, we were able to develop innovation grants. And this is where I'm really excited, because I think this is really where the rubber has hit the road. I'm going to make sure I stick to my notes, otherwise Deb knows that I get a bit excited. But one of the things that's happened with this network is that the members have been able to work together to amplify the voices and achieve greater impact through funding initiatives across the sector. The network provides the necessary infrastructure to facilitate decisions and creates equal space for all members, regardless of their size and influence, to have a critical voice and a chance to make an impact. It's really important with this pie that you're going to see, which is how we work, that we have this shared purpose of improving outcomes for children, young people and families. At the time it was kids in out-of-home care, but we realised that we needed to do more to prevent young people going into care, and also when kids were leaving care. Over the last 5 years, we've had some really impactful contributions for Victorian children and families experiencing vulnerability. And this innovation grant has enabled projects that focus on innovation, systems change, and collaboration across the sector. We've tried really hard not to make it competitive. I know that at times it is, because there's an application process, and I can see Rosie smiling, but we really don't want to make organisations compete against the sector. So it was new money that we were able to bring in a different way, that wasn't kind of taking away from kind of current grant rounds that we had. It was really important for us to do this with the centre, as they have that knowledge and understanding that I've touched on before. But I think one of the reasons that the centre wanted to be involved was they knew it wasn't straightforward, and they would also be able to help us to map what was currently happening and where the gaps were. And it was a chance to help the sector to be more strategic, both with philanthropy and with out-of-home care services. And funders wanted to be involved, as there was an opportunity to increase our strength, our advocacy, and leverage around a particular issue. And there was also an opportunity to learn. So the innovation grants, the first one that came through was Brighter Futures, and this was led by Anchor in collaboration with 11 other organisations. And I think many of you, well, actually, I'm sure most of you on the call, if you're from Victoria, will know about Better Futures, which Brighter Futures was able to lead to. So the findings of this pilot highlighted how such services can accentuate the voice and agency of young people exiting out-of-home care. And Brighter Futures illustrated both the need and the challenge of systemic change, and how philanthropy can play a role in highlighting these issues. But we also need to learn. And one of the things that we were able to learn from this grant was that it was only for 2 years, which really wasn't enough time for Anchor and the rest of the partnership to have the time and the leverage that they needed to do. The second innovation grant was with VAADA, and this program is called Bringing Up Aboriginal Babies at Home. And this project is designing a program that works with young Aboriginal women and their partners who are at risk of having their baby being placed in out-of-home care birth. And if the removal has already occurred, then seeking reunification with their baby. And the findings from this program will feature in the TriPeaks webinar series later this year. So make sure you tune in for that, because I think you'll be really excited by what potential there is with this grant. But a couple of final thoughts about collaboration. Timeframes can be different and difficult, and I know it can be a lengthy process for people. Collaboration takes time. Sometimes the process can take you a year to actually be able to work well together. We were coming at it from funding individual funding requirements, and this, like, all of the different funders have different authorising environments that can be really challenging to work through, but making sure that all of those eligibilities are ticked off, but in an easy way for the sector. And there can be risks in innovative funding. I think that's the thing, like, you are testing new ideas and you don't know that it's going to work, but what you do know is you have to give it an opportunity, and that you can learn along the way and then change things and make them work. So it's been an opportunity. It's been a natural fit for us to work closely with the centre. And I still remember the Commissioner for Children and Young People talking about, when Deb was saying it then, 445 children in residential care. And I remember one of the funders saying, you could name every child, like that's a small primary school, and all of those children and the outcomes that those kids are having in residential care, we need to do better. We know that there's a significant investment that's coming from the government and incredible work that's coming from across the sector, but we needed to help these young people to have every opportunity. And so when we partnered with Youthlaw, one of the things that struck us at the time was that it was giving voice to children and helping them to understand their rights and the opportunities that were ahead for them. So I am going to pass back to Deb now, if that's okay. Is that the plan? Great. And I'll stop sharing. I can see that there's something in the chat, but I think we're going to come back to questions at the end.
Yeah. Emily, that was a fantastic, really concise but instructive presentation on the role of philanthropy, but also the role of the network, which is becoming, people are becoming so aware about the model. And as Emily and I talk about this often, we're pretty proud of our philanthropic model, our network, and there are some others that exist out there. But we like to think ours is up there with the best. So if you want to know anything more about that, please get in touch. We're really happy to talk to anybody to educate you about what we do. But also you might have ideas that you'd like to share with Emily and I. So now I get to introduce the wonderful Rosie Mullany, who is the Project Officer and Youth Advocate. She's leading the innovation project Stand Up for Our Rights, a youth empowerment project, which, as Emily has talked about, is an innovation grant made possible by Equity Trustees, the Gandel Foundation, the Barr Family Foundation, Sidley Myer Fund, and the Jack Brockhoff Foundation. The project operates as a partnership between Youthlaw, Ballarat Community Health, Child and Family Services, or CAFS as we know them at the centre. Always seeing that long name always throws me. Berry Street, Victoria, and Central Highlands Care and the Family Services Alliance. Rosie has worked with and for young people for about 20 years in a variety of roles in the community, education and legal sectors. She's a passionate advocate for young people's rights and for ensuring that young people have a voice and agency in their own lives. And as Emily said, at 445, it's probably just a tiny bit more than that. We could easily know all those young people's names. And so this initiative was a bit of a no-brainer, I think, for the network in having a focus on children in residential care and looking at how we could empower those young people within the context of their care, but also to set them up for life. So, Rosie, over to you.
Thank you, Deb. Thanks for that introduction. Lovely to be here. I'll just start by sharing my screen. There we go. And Emily and Deb have already done, already acknowledged country, but the only thing I'd like to add to that is that I'm lucky enough to be living and working on the beautiful Dja Dja Wurrung country. Myself, my partner, and indeed my 2 dogs, very grateful for this beautiful country that we live on. Yeah, let's get started. So the project Stand Up for Our Rights. Just to start with, just a little bit of an overview to begin with. We initially secured funding in 2021 from the Out of Home Care Network. Apologies there, I've still got the old name. And our funding will continue until July 2025. And the project was informed by research, particularly some of the CCYP, the Commissioner for Children and Young People reports. So you can see up on the slide there, as a good parent would, in our own words and out of sight, all really important reports that really highlight what the experience is like for our young people in residential care. And what those reports tell us is that young people in residential care overwhelmingly report a lack of control, knowledge and trust. They often feel very angry and frustrated, and those feelings can be sometimes vented against staff and into some damaging behaviour and actions. Victimisation of young people in residential care, including sexual exploitation, is significant and very concerning. And these young people also often have multiple unmet legal needs and are not necessarily knowledgeable about the law and about their rights. The other important document that kind of underpins the project as well that's really significant is the framework to reduce criminalisation of young people in residential care. So that framework aims to reduce the unnecessary and inappropriate contact of young people in residential care with the criminal justice system. And it establishes a commitment across government departments, Victoria Police and residential care service providers. And one of the things it does is it sets out a decision maker's guide that informs workers about whether police should be called, whether they should be involved in incidents with young people in residential care. The project also draws on Youthlaw's experience supporting young people leaving care via the Legal Pod programme. That's a programme Youthlaw have been running for some years. In that programme, young people exiting care can be supported for up to 3 years by a pod of lawyers, and so we find that young people can dip in and out of that service over the 3 years with varying legal needs. And the project also draws on the existing relationships with some existing collaborations between key stakeholders in the region, and you're going to hear a lot throughout the presentation about just how important partnerships and collaborations are to our project. And in a very, very small nutshell, what we're trying to do here is we're trying to provide a broad range of legal and advocacy services to the young people in residential care in Central Highlands, which when we initially started was 31 beds across 10 houses managed by 3 different providers. Now that has changed somewhat in this last 12 months. I'll come back to that, but that's how it was when we set up. So clearly, young people in residential care experience an incredibly complex and unique set of circumstances. I'm sure everybody is also aware that our current system is deeply flawed, and a lot of and young people in residential care are some of the most vulnerable and traumatized young people in our society. So clearly, with something like this, a situation this complex has got no clear and obvious solution, and that's where there's a real place for innovation and cross-sector partnerships. This is kind of where no one sector or one organisation can really solve the issue alone. So we're incredibly grateful to the Out of Home Care Network and the philanthropic funders who've supported this project. We've found that the flexibility afforded to us by the funders has been essential in allowing us to try a new approach, to continually review and adapt our approach, and to keep that cycle going. Because I think, unfortunately, most of us, certainly speaking for myself here, are used to much more restrictive and inflexible approaches to running programs and projects, and they don't really allow for true innovation. So yeah, that more rigid prescribed approach to funding doesn't allow us the freedom and flexibility that's required if we're ever really hopeful to make a dent in these really, really complex problems. So yeah, very grateful for that support. Just onto the aims of the project. Our kind of main overarching aim within our project is to reduce criminalisation and victimisation for young people in residential care. And sitting underneath that are our other main aims, which are to improve young people's knowledge, understanding and confidence to assert their legal rights, to improve staff capacity to support young people with their legal needs and to uphold their legal rights, and to work collaboratively across partner organisations to problem solve complex systemic issues. So let's just go on to explain a little bit about our partners and stakeholders. When I was putting this together, I was kind of just trying to show in sort of in a bit of an infographic the key kind of players and just how kind of complex it can be with the different people that are involved in something like this. So what you'll see on the slide, we've got Youthlaw there on the top left. Youthlaw are the lead agency within the project. Youthlaw employ the project officer and youth advocate, that's me, and the lawyers. And just a little bit of background, Youthlaw is Victoria's statewide free community legal centre for young people under the age of 25. And we at Youthlaw, we're addressing the legal issues faced by young people through legal services, advocacy, law reform, preventative education programs, and we do that within a human rights and social justice framework. So back when this initially began, Youthlaw and Ballarat Community Health got together. They have an existing relationship. Youthlaw has run the Health Justice Partnership from Ballarat Community Health for some years now. So Youthlaw has A great lawyer, Katrina Fanning, who sits at Ballarat Community Health, has done for some years, providing legal support to under 25. So that was a great basis to kind of start this process. So Youthlaw, Ballarat Community Health got together with the Care and Family Services Alliances, and in our region we have we've got the Care and Family the Care Services Alliance, as well as the Family Services Alliance. So the Family Services Alliance is funded by Department of Families, Fairness and Housing, made up of family service providers and partner agencies. But we also have the Care Service Alliance, which is a voluntarily developed alliance in our region, made up of care service organisations and their key partners. So those alliances, Ballarat Community Health, Youthlaw, got together, put in the application, and thankfully received the funding in 2021. And over to the left of the slide, you'll see our care service providers. Now, when we started this, I suppose started service delivery just under 12 months ago, there was CAFS, Berry Street and Catholic Care, who were providing residential care services in our region. That's changed within this last 12 months. Catholic Care no longer providing that service. And that's why you'll see that Youthlaw, CAFS and Berry Street are joined like that on the diagram. But Catholic Care obviously still really important. They've been really involved in the project, but also are a key provider of a lot of other services in our region as well. So that's the sort of the care service providers. Victoria Legal Aid, you'll see over on the other side as well. The VLA provide a whole range of legal services across the state, and Youthlaw work closely with them in general and on this project specifically. And as I said, they provide an awful lot of different legal services, but they include representation to young people under 18 for child protection matters, and representation to under 18s who have been charged with a criminal offence. Now, Youthlaw also provide some legal support and representation in criminal matters, and within this project we've already been able to provide some of those supports to young people. But whether we take on that that criminal matter and support that young person, or whether VLA does, very much depends on the specific circumstances. So we do work closely to decide the best service for the young people that we see. And then I've just listed additional stakeholders. So there are a number of other very important stakeholders who I haven't specified, but who potentially have really important roles to play. So there's stakeholders we've identified that we're already starting to work with. There's stakeholders we've identified that we want to work with. There's those that we're aware of that maybe could be pivotal in future plans, depending on exactly which way we go. So lots of different stakeholders, not least our local First Nation service provider and community representations, DFFH, BICPOL, just to name a few. So I suppose the point I'm making there is just there's always a lot of work to be done in developing and managing partnerships. On to a little bit about innovation. I just wanted to highlight a few points here that we think makes our project innovative. The project is a rights-based, or comes from a rights-based empowerment approach. So we know from experience and from research that young people in residential care feel significantly disempowered. They've got very limited control over their own lives. And through this project, we wanted to assist in giving these young people a voice in the decisions that are made about them, and to increase awareness of their rights broadly, at work, school, in relationships, online, but also specifically their rights to meaningfully participate in the care system decisions. Cross-sector partnerships, also very important. Obviously, I've just outlined our main project partners. But the other point I just wanted to make here is about the nature of cross-sector partnerships. So particularly in regard to having a legal service and care service providers working so closely together. This is one of the things that makes this project unique and somewhat ambitious, I think, as well. And I'm going to touch on this a little bit later, but for now, I'd just like you to consider what some of the differences might be in these two services. So what differences might there be, you know, in a legal service and resident care providers in those two services? And given what some of those differences might be, what might be some potential tensions or challenges that you could envisage? And what might it look like for those for providers of residential care and the legal service to work together with the aim of empowering young people to know more about their legal rights? So I'll just leave that with you to have a think about, and talk a bit about systemic change. So another important factor here is that we want to make some systemic changes at a local level with this project. So again, that will be utilising our partnerships. We hope to tackle some of these systemic issues collaboratively as a group. We have a couple of mechanisms that we can, I suppose, utilise for that. We've got our operations group that meets monthly, and that group's made up of the project staff. So currently that's myself and our CEO, plus key staff from each of the care provider organisations. And that group focuses on the day-to-day activities and implementation of the project. We've also got our steering committee, which meets 4 times a year, and that's made up of a range of representatives from across the sector, and it oversees the project at a strategic level. So these are mechanisms we hope will be useful in assisting us to problem solve some of these systemic issues that we're seeing. And just as a bit of an idea, some of the early discussions that we've been having about things we might want to tackle include things like young people who are missing from care. So when young people are missing, how are they supported? How are they responded to? How are safe custody warrants executed when young people are returned to the houses by police when they've been missing? Another thing that we've discussed is the experience of young people when they're reporting sexual abuse and exploitation. So what supports are in place when young people are reporting those things? What do the current reporting processes, how do they impact on our young people? So you can see there's some pretty big issues to tackle, and we're still working on identifying the specific changes we want to try and affect, and just exactly what that might look like. And finally, we're trialing and testing a new model. So again, I mentioned at the start just how important it's been for our project to be able to try new things, to adapt to what we've learned, and to continue in that process. So we're constantly gathering formal data, as well as having ongoing conversations about how we're going and adapting to what we learn. So our journey so far, as I mentioned, we're nearly at the point of having delivered 12 months of direct project delivery. So just to step back a second, it was in July 2022, we initially appointed a project lawyer. And then I actually came on board as project officer just after that in August. And together we started delivering the service to young people in September of last year. And then quite early on, we wanted to recruit some young people with a lived experience of residential care to act as consultants to the project. So we recruited 3 youth consultants, and we've conducted 2 sets of consultations so far on a range of issues. Some of these are things like intake and referral forms, our general approach to engaging with young people in residential care, the topics that we're trying to include in some of the information we provide to young people, and any general tips and advice along the way as well. So these 3 consultants have expressed they'd like to remain involved. So if that remains the case, then the plan is definitely that we will continue to consult with our consultants during the life of the project and ensure that we are, we do have that voice of young people with residential care experience. We've also provided a broad range of legal and advocacy services to a fairly small number of young people in residential care. So initially, the project lawyer and I worked, we'd work very closely together, meet young people together. And then I suppose as our practice developed, I began taking on some more of the advocacy work, particularly where that relates to care system issues. And so at that point, it was decided would rename my position to what it is now, which is project officer and youth advocate. And so, yeah, I've been taking on some of that advocacy work, and then obviously the project lawyer conducted the legal work. But we were also able to work together a lot on delivering legal education, providing secondary consultations to staff. We also tried to spend a lot of time in the initial 6 months or so building relationships. So we would try to get out to the homes as much as possible, meet as many staff as we could, generally raise awareness about the project, as well as providing some legal education sessions to staff who would generally the residential care staff and case managers. And when the project was initially sort of conceived, there was definitely a focus on young people leaving care and supporting those young people as they transition out of residential care, to ensure that their current legal needs were being met, but also that they know where to get supports in the future if something occurs. So once a young person becomes independent, there are likely to have some additional legal needs. So things that might occur could include issues with tenancy, driving, working, debts, things like that. And we're probably more likely to see those as young people become independent. So that was kind of always a focus. But once we started delivering the project, we realised it would be beneficial to expand the reach to include young people who've recently left care. So often those young people are accessing the Better Futures programme that supports them up to the age of 21. So, we've really tried to connect with those services in our, the Better Futures providers in our region and connect up with young people who are accessing that service. But that isn't by any means required for a young person to be able to access support from us, in that period of leaving care. So we expanded that relatively early on. And the other important point here, I suppose, is the monitoring and evaluation. So initially, we utilised an external consultant who worked with our steering committee to formulate an evaluation framework and theory of change. And we collect ongoing data and have recently completed an internal 6-month evaluation. That's been really helpful just in helping point us in the right direction and where we're heading to next. We've also recently completed a planning workshop, which was attended by project staff and key staff at provider organisations, but I'm going to talk about that a little bit more in just a sec. So that's our journey so far. On to some challenges. Obviously, any innovative project has some challenges. And I don't think, I'm just checking at the time, I might not get through all of these, but I'm going to start by just touching on engagement. So engagement in a project like this is a challenge in relation to young people and to staff. So in regard to engaging young people in residential care, there's a range of potential barriers to overcome and issues to take into account. As we know, young people in residential care have experienced significant trauma in their short lives, and they have to deal with really significant and constant upheaval and uncertainty. They've had a lot of workers come and go, and they've got really good reason not to trust adults. They're also missing from placement a lot as well. So as a new adult coming into their lives, offering a new service with quite a bit to overcome. And in regard to workers, this can be an extremely challenging and potentially stressful space to work in. So, day-to-day work often involves managing crises. Work days can be very unpredictable for staff. So all in all, both workers and young people can actually be pretty hard to pin down. And there's so much going on for young people and staff alike. Both have got very stretched resources. we're bringing something new into the mix, and it can be, it can take time to gain traction with something new. So that's certainly, one of the challenges we've experienced. The other one I think it's important to point to is different models of working. So I mentioned earlier that it might be worth considering what it might look like for a legal service and a residential care provider to work together. So I'm sure everyone here is very well aware that providers of residential care utilise a best interests approach. So the interests of the child or the young person are paramount, and staff in residential care homes are responsible for the safety and the well-being of all their young people. That's a great deal of responsibility and can be very challenging, situations. So that's where they're coming from. Now, as a legal service, Youthlaw operates a little differently. So obviously we still care greatly about the young people we work with. We care greatly about their safety and their well-being, but we operate from a rights-based approach. So lawyers and legal services advise people of their rights and their options in law, and then take their instructions from their client. So it isn't our job as a legal service to decide for the young people. Even if we believe that doing so would protect that young person's safety, that's not our role. So in other words, we're not acting in the role of parent in the same way as, residential care staff are. So you can probably begin to see that there are some potential tensions that might arise there. So for us, what happened after 6 months or so, it became clear that we'd need to do some more work as a group. And as a group, I mean Youthlaw and the care providers, to just really address this tension, making sure we've got a really common understanding of exactly what activities we'll undertake during the course of the project. So really, it was the how. The how needed a little bit more work. And in particular, how do we do what we want to do whilst also working collaboratively, not in any way in an adversarial way, and not in any way that could negatively impact the relationships that young people and their carers have. So the young people and the residential care staff, those relationships really are key to keeping these young people safe. So they were really important considerations. So just quickly, I'll touch on staff turnover and remote work, because they feed quite well into this, the challenges we've had with the different sort of models, because again, everyone will be really well aware our sector has a quite high staff turnover, or certainly a lot of movement. So we have a lot of fixed term contracts. We have a lot of staff moving within an organisation to different roles. Unfortunately, we do also lose staff through burnout, and it's a fairly challenging landscape to sustain partnerships. Often what we find, obviously, is you get one particular staff member within an organisation that's really passionate and really drives a partnership, really keeps the momentum going. And if that staff member leaves, sometimes it can be a bit of a challenge to maintain the momentum and the understanding within a partnership. And we have had significant and numerous changes to staffing during the course of our project so far. And also, I mentioned before, we've had a change to the actual providers of residential care as well. So that's been a challenge. Obviously, we're all working in a pretty different landscape since COVID. So, we're all doing more remote work. That has pros and cons. We've found that having more remote work and having a lot of our meetings happen online, particularly our operations group meeting, which is our main mechanism for implementing the project, it's meant we've very rarely, if ever, met face to face. So, that together with changes in staffing, coming from sort of different perspectives, those things together have, definitely sort of added to our challenges. So in an attempt to address some of these issues, we thought we'd bring together key staff face to face in a planning workshop. So we did that very recently. We used a skilled external facilitator that was really important because we wanted to have that, objectivity. The aim of that that planning workshop was to review our project activities, just to make sure we looked at what was working well, anything we wanted to change, and really look again, like I said, at the how are we going to deliver exactly what we want, how are we going to make sure we deliver on the main aims of the project and ensure as much positive impact as possible. So where are we now? So the planning workshop was really positive, great to actually be face-to-face in a room, that was fabulous. And we continue to utilise our ops meetings to finalise our review of our project activities. So this is where we've come to at this point. So focus on relationships. Now, this certainly is not to say we weren't already focusing on relationships, but I think we've come to realise just how important it is that we build trusting relationships, particularly with frontline staff. And we know that takes time. So one thing that we're doing is I'm now going to be working out of the offices of the care providers at least one day a week to really assist in building those relationships. We also want to focus on embedding our partnership so that it can withstand those inevitable staffing changes. We're lucky that one mechanism we have for this in our region is an existing partnership, the Youth Justice Innovations Partnership, or YJIP, which, as I say, it's an existing partnership that provides some high-level oversight to a number of innovative justice-related programs, which Stand Up for Our Rights is one. So that's another mechanism we want to, I suppose, utilise some more to really embed the work that we do. We'll continue to provide legal services. The only thing that's, I suppose, changed slightly there is that we no longer have a dedicated project lawyer, but we do utilise our existing lawyers who are fabulous, Sophie and Katrina, who are already based at Ballarat Community Health, providing services to under 25s. So they will, continue to take on legal work for the young people specific to our project. We also will have focus on a collaborative approach to advocacy. Again, not that it wasn't collaborative, but just sort of a slight refocus for our advocacy work. So particularly, advocacy for care system decisions. If a young person has questions, concerns, or wants to be more involved in the decisions that are made about their lives, my role as youth advocate will be to really amplify their voice within the existing care team. And then that care team together will be responsible for responding to the young person's needs or wishes and to problem solving issues, that arise there. And so I'll really be, I suppose my role will really be keeping that young person at the centre and their voice central. We're also going to focus on empowering frontline staff. So, for the frontline staff, particularly in residential care, they often have very little control within this big system. They can often feel quite powerless to affect change. So Youthlaw and our provider organisations will work together on improving staff knowledge, their capacity and their confidence in asserting young people's legal rights, and also to raise the systemic issues that they see. And finally, we'll continue to collaborate for systemic change. We'll utilise our ops group, our steering committee, to identify and problem solve systemic issues. We've also got the YJIP, the Youth Justice Innovations Partnership that I mentioned earlier. And we're at the point now where we want to hone in on one or two very specific issues or areas that as a group would like to work towards achieving some change in. So by the time we deliver our final findings after July 2025, we're certainly in the hope that we'll be able to report on some specific changes that we've achieved as a result of our collaboration and our partnerships. And that's really it for me, but I'll maybe hand back to Deb to see if we've got any questions.
We do have questions. We do have questions, and I've got some questions as well. Thank you, Rosie. I think that there will be lots of people on this call who are working in this space. So they're either young lawyers or they're practitioners or they're managers. And a lot of the things you're talking about would have actually they would have had lots of aha moments. Okay, so I think from a programming, practice, evidence point of view are really useful to hear you talk. So some of the stuff that, before I get to the questions, that really rung out for me, and partly because my early training was nursing, is the cultural difference between professionals that you talked about, which is not a judgment, it's just a reality. And I think that off the back of this initiative, I think there's going to be, whilst they are, yes, of course, they're often not taken into consideration and not well understood. So when you were talking about collaboration and trust and all of these things, they do relate right back to that very different professional frame. And so I'm really, really grateful that you really pulled that out quite a bit, because for the funders, they're talking collaboration, and you're talking about collaboration, but at a practice level, around different practice paradigms. So I really enjoyed hearing you talk about that, because I actually think that part of the problem is we all think it's simple, and it's never simple. Like, it's just not simple. So I really enjoyed listening to that. Now we do have some questions. I'm going to go to them because I think I always honour the fact that people come and they listen. They're often doing this in their lunchtime, and they don't have a lot of time in the day. So I want to make sure we get some of the questions answered. So one of the questions here about how did you identify and engage your youth consultants? So not a simple question, but a nice question nonetheless.
How did we do that? Look, we utilised some existing networks. So we utilised some networks within the Centre for Excellence. Where else did we use? Within Create Foundation, and basically, advertised as widely as we could across the networks that we had. And then from that, we looked at the responses we got, and we didn't, it's not like we had heaps and heaps and heaps, so we didn't need to do a really we didn't need to kind of do a hugely formal kind of recruitment process, but we managed to pick out these 3 young people that were clearly clearly had the experience, were passionate and articulate, and wanted to be involved. And we just went through that process. And then we have initially we thought we'd kind of do consultation as a group. We've done it online rather than face to face. We've got sort of consultants that are not all in our region, so it probably would be quite difficult to get together. But we thought we'd do a group, but then when we spoke to the consultants, they all wanted to do it one-on-one, and I can totally understand that. So in the end, I think we've mostly done phone calls, because that's been the consultant's preference. And we've been very, very clear prior to each consultation. This is what we're looking for. Here are the questions beforehand. Here's what we're going to pay you for this. They're all remunerated appropriately. Is that all okay? And then gone ahead, consulted, and they've all always had the opportunity for debriefing as well. So yeah, that's working quite well so far.
Thanks, Rosie. I'm going to go to a question for Emily now, and then I'm going to come back to you, Rosie. So, Emily, can you talk to us a bit about collaborative philanthropy and why? Because I think that this sort of, we talk about it a bit, don't we, at the centre and at work. And, it sounds easier than it is, doesn't it? Like, I mean, we've been doing this thinking and this work for some time, but it's actually it's challenging, isn't it? It really is. And we think it's easy. I mean, Rose sort of illustrated how hard it is. Just through this initiative, it's a work in progress. Do you want to talk to a little bit about how important it's going to be for the next round of funding?
Yeah, it is. It's and I meant to talk about this, but it can be really challenging. And Rosie, when you were speaking about different ways of working, funders work really differently as well. Like, I mean, I think we're all coming at it with wanting to invest in children and create different pathways and better pathways and opportunities. But because there's such a different authorizing environment, different criteria, different objectives of funders, but for me, it's been time. Like, you actually just need to kind of commit to turning up and being flexible, and it's not co-funding. I think that's also a difference, and that's something that's really important for us, because with Youthlaw, we don't want them to have to acquit 6 different funding applications, we want them to have kind of one point of contact, which has been the centre, rather than having to, every time there's a problem or an issue that they need to talk about, actually having to go to the different funders. So for me, it's about the collaboration part has been investing in those relationships and where can we make a difference? Like, where can we kind of come together?
Yeah, that's fantastic, Emily. Thank you. So I've got 3 more questions I want to go to. So Rosie, can you talk a little bit about the Youth Justice Innovation Group? You mentioned it, and Anita's really interested in it. And if you can keep your answers short, because I want to get, there's a couple more questions, and we've got 4 minutes to go.
Okay, I'll be as quick as I can. Basically, it's an existing partnership between government departments and local organisations that has some high-level oversight of a number of key justice-related initiatives. Stand Up for Our Rights is one. There's 2 others. One of them is a new project, Goldfields Education project, that is about assisting to engage young people that have disengaged from education. And the other one is the MAST, the multi-agency, oh gosh, I forget the acronym, but it's a crime prevention initiative that's been working very well for a long time, well, not a long time, for a few years in our region. So that's an existing partnership that exists.
Fantastic. And just a couple of other things. Emily would be interested to know, was there any difference between a therapeutic and non-therapeutic team in terms of the way you worked, or whether there were more or less issues?
Yeah, so some of the homes we've been working with our therapeutic models. Some are not. I think we had initially 3 out of, was it 10, with therapeutic homes. We've lost one of those, so now there's 2. So there are some, but then they're not all. Currently, they're not. They're not. So yeah, I mean, it doesn't. I haven't seen that make a huge difference in practice to the work that we're doing.
Yeah,
to be honest.
And I think that might change over the next sort of 18 months. So it'll be interesting to keep an eye on that one. And the last comment, I've got to have this comment, and I think that I'd like to hear Emily's views on this as well. Given the appalling age of criminal responsibility that we have in Australia, which is an embarrassment, let's be frank. I'm interested to know what you see as your, I mean, there's this project, but there's other things that you do, Youthlaw do. Should there be some collective action from this partnership that adds their voices, or do you already add your voice to sort of lifting the age of criminal responsibility? Because I think, you know, it really is resounding now, like this call to change the way we think about child development. So it's just you don't have to say anything, but I mean, for me and for us at the centre, it's a very big issue.
Yeah, and look, just quickly, Youthlaw has been very involved, you know, in that campaign to raise the age of criminal responsibility. You know, so potentially, yeah, there may be a way for us to also utilise, you know, some of the voices of the experiences of this project into that campaign as well.
Yeah, thank you, Rosie. And Emily, just some comments and reflections from you. This is a really big issue. You know, the unfortunate transition for some young people from residential care directly into our justice services is also a huge issue, which is one of the reasons why we value this initiative so much, Rosie, because it has a number of legs. You know, potentially preventing children from, you know, ended up in one big one. But any from you?
No, I would disagree with that. Like, it's terrible, and we need to. Like, I'm glad that it's getting more attention, but it needs far more attention, and it needs to change. And if there can be examples that come from the sector where of the impact, I think that's really important to do.
So I'm going to wrap us up. I just want to say this has been an opportunity for me to immerse myself into a great passion of mine, which is children's rights, Rosie. Often when in a busy day, you don't get to do this, you don't get to talk about how important it is to listen to young people. I think your comments about taking directions from young people, when you'd like to sort of tell them, no, don't do that, that actually it's about listening to young people. It's about their own learning, and it's about supporting them. And it's also about providing them with insights into what's available for them should they need to take up those services. You know, Emily knows how I feel about the work that she does. She's incredibly articulate and has really taken that sort of really unknown world of philanthropy into a really tangible space. And I know people like Rosie and Ariel and, you know, VAADA, I feel eternally grateful for the work of the network. I can see Anita Hopkins is on the call. There'll be other ones of our funders on the call as well. I want to acknowledge all of you. We couldn't do this. Rosie said it. This work could not be done without the flexibility that our trusts and foundations provide for the discovery. Rosie talked a lot about the twists and turns in this project and the honesty that comes with that. So I just want to say thank you to the funders and thank you to Rosie for stepping in and stepping up, because I know Ariel's on leave. And I hope that those on the call, there's lots of claps coming out now. I hope those on the call have enjoyed this. This is a very granular project. We got into the weeds today, and I actually think it's really important. So thank you everybody for taking the time to come and sit in on and participate on this, and look forward to seeing you all again really soon. Thank you.
Thank you. Bye.
Thank you.
Bye.